All right, this is the last section for exam 4, which is coming up soon. And what this picture or figure shows you is a figure from chapter 38, which talks about your basic anatomy and physiology of the musculoskeletal system. These 3 cells that you see here, the osteoblasts, the osteoclasts, and then the osteocytes down here are very important for maintaining proper bone architecture. You will need to know what these different cells are. Some of you already know that, so it'll be review. Some of you will need to learn the function of these different cells. And you have a video to start this section off, which you should already have watched, that gives you a good introduction to the functions of these cells. All right, the first disease we're going to look at is osteoporosis. Osteoporosis is simply porous bone. The disease process takes place over several decades, making it a chronic disease. And it's not an issue necessarily with aging, in that age is not a cause of the disease, but rather it is seen in individuals who are elderly because of the fact that it is a chronic disease and it takes several decades to show. So just because you are 70 years old doesn't mean you're going to have osteoporosis, because there are plenty of 70-year-olds, 80-year-olds who do not have osteoporosis. And then there's going to be some individuals who might be in their 40s or 50s that actually have diagnosable osteoporosis. So the first sign that typically indicates osteoporosis are going to be different types of fractures, and the different causes of how this disease begins is going to be hormone in nature. Right? As a person ages, there's decreased levels of estrogen and testosterone being produced. That will affect the bone activity. Decreased physical activity, because physical activity helps to jar the bones and activate those bone cells. And then inadequate levels of vitamins D and C, and even magnesium, as those play a role in maintaining proper bone architecture. All right, so as I mentioned, osteoporosis is porous bone. So it's demonstrated by reduced bone mass or density. And there's an imbalance of bone resorption and formation. So our bones are constantly being regenerated in terms of old bone being resorbed and new bone being laid down. All right, so here you have figure 39.8. I like the quote from your book about who the World Health Organization describes or defines osteoporosis, and that's a systemic skeletal disease characterized by low bone density and microarchitectural deterioration of bone tissue with a consequent increase in bone fragility. So you can see the differences between these two trabecular bodies. The one here demonstrates osteoporosis. Over here is normal bone, and there's a lack of bone density. And what you can see with this bone is there's actually horizontal tuberculae that are missing over here in this osteoporotic portion of bone. All right, this is a good figure to look at just because it compares the different types of bones. You have compact bone and spongy bone, normal here, and then over time, where osteoporosis is going to take the effect on the bone architecture. You can see over here on the right side where there's very little bone density of bone material there. All right, with men, because of the nature of a man's bone in general, it's going to be thicker than women, and so men often just show thinning of the bone, whereas women, that bone thins such that it gets so thin there's perforation. All right, we probably think more often that women have osteoporosis more often than men, which is probably true, but both genders can experience osteoporosis. The reason why women are, it's seen more heavily in women is because of over here, where we see that men actually begin with more bone mass than women do. So men can lose more bone before they start to show an effect. All right, so women have less bone to begin with, and then there is a greater decrease. All right, you see a bigger slope in this line for the females versus the slope in this line of overall bone loss, net bone loss. All right, another disease is osteomalacia. This is a deficiency of vitamin D. So it's a metabolic disease characterized by inadequate and delayed mineralization of the bone. So this mature contact and spongy bone doesn't develop, and the remodeling process proceeds normally through the osteoformation, but lacks the mineral classification deposition. Right? So the bone volume stays the same, but it's soft bone, and that's because of the vitamin D deficiency. So issues leading to vitamin D deficiencies, it can be just a deficient diet. It can be decreased endogenous production of vitamin D. There can be issues with the intestinal tract for malabsorption. And then kidney disease, liver disease, that's going to play a role in the activation of vitamin D itself, or different proteins that play a role in that process of vitamin D activation. So, inadequate or delayed mineralization. All right, so the result is soft bones, and that can develop with or cause pain, can cause bone fractures. You can have vertebral collapse, and then bone malformation as you develop those soft bones. And you've got quite a bit of lecture notes underneath your slide that talks about osteomalacia. All right, the next disease is Paget's disease. Can also be called osteoitis deformans. And this is also a metabolic issue. All right, it's a state of increased metabolic activity of bone characterized by abnormal and increased bone remodeling. So there's an excessive resorption of spongy bone and an accelerated formation of softened bone. So the bone is being laid down very quickly, but it's disorganized, it's thick, and the bones are soft. Most often is going to affect the axial skeleton, and so this can cause abnormal bone curvatures, it can cause brain compression, and impaired motor function, deafness, because it's putting pressure on nerves within the ears. There can be atrophy of the optic nerve. All right, and there is a short video on Paget disease about one person developing this disease. So again, read through the notes below the slide. It's actually pretty interesting. And you also have, there's some material on your assignment for these different diseases. Osteomyelitis. All right, this is an infection. All right, itis is inflammation, osteo is your bone, and it is most often going to be caused by a staph infection. Right, the most common cause is an open wound. It's exogenous, meaning the organism gets through the skin and then makes its way through the tissue into the bone. All right, it can also be from a bloodborne infection, and that would be endogenous because the infectious organism is making its way through the blood from within into the bone, wherever that's going to occur. All right, bacteria are the number one causative agents. All right, so staph is the number one bacteria component. Bacteria in general most often cause osteomyelitis, but you can also have fungal organisms, parasites, even viral infections that cause osteomyelitis. But in those cases, that person is probably going to be immunocompromised. So, manifestations: acute and chronic inflammation at the site of that bone infection, fever, pain, necrotic bone. Treatment can be very difficult. It's going to be antibiotics, but it's going to be IV antibiotics because just popping the pills through your mouth is not going to work very well in terms of getting that large chemical component of the antibiotic into the bone. So it's going to be IV antibiotics, could be long-term IV antibiotics, such as, like as long as 4 weeks maybe. There could be debridement, there could be surgery, there could be hyperbaric oxygen therapy to help force the healing stages of the bone to try to get rid of that infection. Alright, so here's a figure that just shows the progression of that disease. You have the initial site of infection here. It gets expanded. You have pus that will develop and cause an abscess to occur. And this continues to occur. You've got dead bone that develops. And eventually, if this goes on for a long period of time, you can actually have breakage of that bone. Alright, then joint disease is a pretty big section here, and you've got a couple of videos on joint disease. Joint disease can be inflammatory or non-inflammatory by definition, and the ways to differentiate that would be absence of synovial membrane inflammation, a lack of systemic signs and symptoms, and then presence of normal synovial fluid. And by definition, decades ago, one was non-inflammatory, one was inflammatory joint disease when you compare osteoarthritis and rheumatoid arthritis. But in all reality, both of them have an inflammatory component. So osteoarthritis is the #1 most prevalent non-inflammatory joint disease. And you do have a video on this, and it does state that there is inflammatory mechanisms going on during this disease. All right, but by definition, it was at once thought to be non-inflammatory. All right, so osteoarthritis, talking about arthritis within the bone itself. It's sometimes referred to as degenerative osteoarthritis, and it's estimated that nearly 1/3 of the U.S. adult population will develop it, and it's equally found between men and women, but women typically have a worst case scenario when they develop the disease. All right, so degenerative joint disease occurs in the bones or in the joints with that bone disease. Increases with age. And the manifestations: pain, stiffness, enlargement of the joint, tenderness, limited motion, deformity. And the characteristics: local areas of damage, so it could just be one joint that has the damage. There's a loss of articular cartilage. There's new bone formation of joint margins. There's subchondral bone changes. And then there's variable degrees of this synovitis, right? So that's the inflammation. So again, variable degrees. Some people have very mild inflammation, which is why it's classified or has been classified as non-inflammatory. Right, but there is some inflammation going on. Figure 3916. This is an older version of the figure, but I like this bottom part, the cartoon version of what's going on, and it shows you the degenerative joint here compared to the normal joint. But you're losing this cartilage here. You're having thickening and distortion of the capsule, the joint capsule. You have some inflammation that's going on. And then up here you have different nodules that occur. These are you have Bouchard and Heberdean nodules that occur at different joints,